welcome to the first lesson of the Medicare Masterclass, where we're going to go over original Medicare. We've got the lesson broken out into 4 parts. We're going to talk about how you qualify for original Medicare, because original Medicare is the bare bones of Medicare. When you hear Medicare, this is what you're talking about. We're going to talk about all the parts so you don't get confused with all of the alphabet soup when it comes to all of the letters, like Part A, Part B, Part C, Part D. We're going to talk about how much it costs and what you kind of can expect, because original Medicare is an insurance policy in itself with nothing else. And we're going to talk about what it also covers in this lesson. So let's dive in and get started. How do you qualify for original Medicare? Well, first, the way to qualify that most everyone does is by turning 65. That is the golden number where you make the transition to Medicare and you're good there. So when you look forward to your birthday, turning 65, you'll have a 7-month window around that time. It starts on the month you turn 65, goes 3 months before, 3 months after. That's called your initial enrollment period. We'll talk about that more in a future lesson, but that's your time to get set up with Medicare. And your Medicare will start on the 1st of your birth month. In my case, I'm a December birthday, so December 1st is when my Medicare would start, if I was approaching that age. So the other ways you can qualify for Medicare is through disability. Now, if you qualify for Social Security disability income, you will have to wait 24 months or 2 years, and you will actually be automatically enrolled into Medicare, no matter what your age is. I have clients who are far under 65, some that are even just in their 20s for this reason, because of a disability. Or the other way you can qualify is through a chronic condition. The conditions that would qualify you for Medicare change, generally you can think of Lou Gehrig's disease, or ALS, and end-stage renal disease. Those are always qualifying conditions that will get you on Medicare. But you can also call Social Security or 1-800-MEDICARE to find out if there are any conditions that may qualify you for Medicare if you're under 65 and are interested in looking into it. So, next we're going to talk about the parts of Medicare, and this is very easy to get confused over. They designate certain aspects of Medicare with letters, and if you don't know what they mean, it can be a little overwhelming. So, first one is Part A. Part A is your hospital and inpatient care. You are entitled to this as a legal citizen, and you've paid your Medicare taxes for at least 10 years. So this covers your inpatient hospital stays, skilled nursing facilities, home health care, and hospice to a certain degree. And basically you can think of this as the big building stuff. You're going to a big hospital, more serious conditions. Next part is Part B, which is your outpatient and medical care. Basically everything outside of the big building, such as outpatient hospital procedures, and doctors and specialist visits, diagnostic tests, labs, all the sort like that are not so serious and more of your general everyday type care you might receive. Now, Part B does have a premium. You may get it paid for you, and we'll talk about that in a future lesson as well, but generally everybody pays a flat premium rate, and that varies every year. And you can go to Medicare.gov to find the current Part B premium, or you can give us a call and we're happy to tell you that as well. Now, just know it can be higher based on your income, and those income limits change and the amounts you pay as well. It can get pretty expensive, but what they're going to look at is what your income was 2 years ago. So today, let's say that the year is 2022. They're going to look at 2020's taxes and see what your income was then and determine if you fall in the limits where you may have an adjusted income, an income-related adjustment amount that you would pay a higher Part B premium. Nice thing is, though, is they're always going to look 2 years back, so next year, when it's 2023, they'll look at 2021's taxes and income, and if you fall back below the normal limits, then you're good there. Part C is Medicare's designation for what's called a Medicare Advantage plan. It's where your Medicare is managed through a private insurance company, and it usually combines your Part A, B, and Part D, which is drug coverage, and we'll talk about that next, into one plan. We have a lesson dedicated just for Medicare Advantage plans because they are more regulated than other supplemental coverage, and there's a lot to know about them. So stay tuned. We'll have more information on that one. And then, of course, Part D prescription drug coverage. This is the easiest one to remember because D for drugs. So this is Medicare standard drug coverage. It can be administered either as a standalone prescription drug plan or as embedded in a Medicare Advantage plan, which we just talked about as well. Now, how much does Medicare cost? We talked a little bit about premiums, and all parts can and may have premiums, including Part A. If you did not pay your Medicare taxes for at least 10 years, you may have a premium for your Part A. I haven't come across it too much, but just know that it is out there. So Part A costs are, you have a deductible per benefit period. So the best way to describe this is I'll take a hospital visit. Let's say you're in the hospital for 5 days. You're going to have a flat deductible amount, which changes each year, usually somewhere between the $1,500 to $2,000 range. It could be more or less than that, especially in future years. But once you hit that deductible, you generally don't pay anything for up to 60 days, which is pretty good. But if you have a catastrophic event such as a stroke where you're in there longer than 60 days, then you're going to have a more expensive copay that is per day you're in the hospital after that. And there is no cap on this limit as well. So Part A is great coverage, but if you do have a catastrophic event, it's going to get expensive very, very quick. So that's why we talk about supplemental coverage to help with these sorts of things. Now, Part B, we did talk about the Part B premium, that it's a standard rate each year. That's your cost of Medicare. And it can be higher if you have a higher income from 2 years previous, and it can be paid for have it paid for you should you qualify for that financially. Now, Medicare Part B is the easy one to remember. Generally, you have a deductible as well that's has fallen somewhere between the $150 and $200 range every year. Again, that could go up in future years as well. And then after that, Medicare pays 80%. You generally pay 20% of the cost for the covered services. Also, no cap on those costs. So, original Medicare, as I mentioned previously, it is an insurance policy in itself. However, it may not be the best option, especially if you have a lot of health problems. For someone who is pretty healthy and may not see the doctor hardly ever, it'll take care of you. But you could be missing out on some extra benefits and more robust coverage at little to no cost more. And we'll talk about that. So, last section of this lesson, what does Medicare cover? My rule of thumb is medically necessary. So Part A is your hospital and inpatient care, your medically necessary procedures there. Part B, outpatient and medical care. It does not cover things such as dental, vision, or hearing unless it's medically necessary. So routine dental care, routine vision and glasses and hearing aids, it does not. If it's going to treat dental, it's because you may have an infection in your mouth. And for hearing, it's going to treat it for balance issues. It, of course, does not cover massage therapy or natural remedies and treatments. They basically just cover what's medically necessary. And so those supplemental coverages can be handy to cover those things that Medicare normally does not cover. And, of course, Part D prescription drugs covers prescription drugs, which also and we'll talk more about it. There's a whole lesson dedicated to Part D prescription drugs as well. But basically, Medicare will cover a certain amount. Well, Medicare requires every company to provide a certain amount of prescriptions in each therapeutic category available. So whatever plan you go with, you'll always have something to cover your prescriptions or for what you need, but it may not be the prescription you necessarily need. But we'll talk about that in the prescription drug lesson. So, more diving into the Part A, it does cover inpatient hospital stay. We talked about all of that, but it does not cover long-term care. This is a big misconception when it comes to Medicare. Medicare will cover home health care and hospice, usually on a short-term basis and medically necessary. It has to be doctor prescribed as well. If you or a loved one needs to go to an assisted living center or long-term care facility, Medicare does not cover that. And your state's Medicaid program may cover that, but they typically want you to be destitute. They want you to spend down your assets before they're willing to pay a dime. So Just know long-term care planning is a thing. You should consider getting long-term care insurance and see if it fits within your budget, because Medicare will not cover it. And kind of going back to the home health care and hospice, it does have to be prescribed by a doctor. And if it's not prescribed, they will not cover it as well. So Part B coverage, we've talked about what it does cover: doctor specialist visits, diagnostic test procedures, durable medical equipment, as well as outpatient surgeries. It does not cover cosmetic services, plastic surgery, things like that. And we talked about the dental, vision, and hearing unless it's medically necessary. So Part D coverage we also talked about as well. Now, one thing to consider with Part D coverage, they typically do not cover bioidentical or compounded prescriptions. So if you do take those prescriptions, you may be able to get an exception to get it covered with your plan, but more often than not, you might have to talk to your doctor to see if there is a substitute that you can use that your insurance would cover. And all drug coverages are not created equal. They're all different. They, as I mentioned, they have to cover a certain number of prescriptions in a therapeutic category, but they do not have to cover every prescription available out there. So that's where we as agents come in and helping you to narrow down plan options to figure out what fits best for you, because every plan is different and will cover your situation differently. So this concludes Lesson 1 for Original Medicare. Kind of gives you the bare bones idea of what Medicare is and what it covers. We're going to talk more about supplemental coverage, the supplemental options that are available to you next in our next lesson, and look forward to seeing you then.